pumping too many chemicals out through that route. And then our exhalation when we breathe out. When we breathe out, we're also getting rid of toxins and carbon dioxide too. So you'll be getting some handouts, and you can follow along. I decided to make this more of a lecture and interactive. You're welcome to ask questions, and we'll save time at the end for questions too. But I wanted you to have kind of the bones of the lecture, and then you can take notes. I'll be telling you some other things that aren't in the handouts and showing you a couple pictures too. Okay, so that's kind of the story of nutrient deficiencies and toxicity, and that's kind of what this medicine is really about, looking at those two places. With the gallbladder specifically, does anybody know where it's located in the body? It's kind of a funny organ. Right, on your right side, kind of right under your rib cage, tucked into your liver, if you ever have pain there. It also has nerve fibers that travel to the back, kind of between the shoulder blades or along the shoulder blades. So sometimes it's known as referred pain. If you have pain in that bile system, gallbladder, liver area, you might actually manifest with pain between the shoulder blades. Think you're having a heart attack or something else. Can take your breath away. Some of you might have experienced a gallbladder attack. But it's estimated that there's about 20 million cases of gallbladder-related disorders a year in the U.S. I think that's probably an underestimate. These are the people just coming to the ER that we're recording, really. And then every year there's about 600,000, maybe 700,000 operations to remove the gallbladder. And so that's another thing in thinking about detoxification. Whenever we can, we want to try and clean the body out rather than cutting out an organ. Not to say that there's not a time and place for removing the gallbladder. If it's an acute infection, life or death situation, and you don't have other options, then that's appropriate for life-saving measures. But we want to try and prevent as much as we can of that, which is what we're talking about today. Okay, so the gallbladder is on the right side under the liver, and it's part of the GI tract. The GI tract is our intestinal system, and the GI tract's really quite amazing. It has 2/3 of our immune system in it. 2/3. So most of our immune system is in the gut, believe it or not. It's also home to 3/4 of our brain chemistry, or our neurotransmitters, if you've heard of those. 90% of our serotonin, which is that happy hormone that antidepressants target, it's actually made in the gut, not up here. There's a big connection between the gut and brain. I know Dr. Ann's given lectures about it before. You hear a lot about it in natural medicine. And one fact you might not have heard in relation to the gut is that it's home to 80% of the lymphatic system. And the lymphatic system is a way that the body cleans itself. The lymphatic system ties into the intestinal system and the bile. We'll talk a little bit about that. And it is involved with the lymph nodes and really all of the tissue. So all of the tissue outside the bloodstream, there's lymphatics involved that help clean the body, and toxins can build up there. And most of that's in the intestinal tract. Okay, I'll let you guys sit down and everybody get a handout too. Okay, so if you follow along in your handout, we'll just kind of go through. And I'll see if I can use this pointer for Paul. Okay. So the gallbladder tucked under your liver here. It makes a substance called bile, and it's stored and concentrated in this bladder. A bladder is just a sac. Like your urinary bladder is just a sac that holds urine. The gallbladder is really just a sac with some muscle that holds bile. And it's concentrated there before it's released in the small intestine. So another word for bile is gall. It's kind of an old word, kind of Hippocrates. Gall and bile are the same thing, and that's how the gallbladder was given its name. So the bile is a yellow-green fluid in the liver. It starts to be made in the liver. It's contained, it consists of 95% water, mucus, bilirubin, which bilirubin is the pigment in red blood cells. So as your red blood cells naturally die off after about 3 months, sometimes sooner, then the hemoglobin is recycled. Parts of that are recycled, and the waste, the bilirubin, is excreted through the bile and through our urine. So that's what gives our stool the brown color, is actually that bilirubin from the red cells breaking down over time. Cholesterol is in the bile, and that helps keep the membranes of our body nice and fluid and us looking youthful, really. Enzymes are in the bile. These are proteins. Good bacteria are in the bile, and that's very important for a healthy microbiome and healthy gut. Some electrolytes like sodium, potassium, chloride are in the bile. Baking soda, a little bit of alkalinity is in the bile. Your minerals, calcium, magnesium, a little bit of sulfur, phosphorus are in the bile. And something very important called phosphatidylcholine. Have you heard of phosphatidylcholine before? It's also known as lecithin. It's normally found in egg yolks, sunflower seed oil, sunflower seed butter has some. But phosphatidylcholine acts like an anchor for fats in the membranes. And toxins usually accumulate in fats. The body tries to keep the bloodstream clear of toxins, and so if it doesn't have what it needs to get rid of it through the liver, it'll store it away in fat tissue, which is peripheral fat, like in the body, or in the nervous system, the brain and spinal cord and other nerves. The brain's 60 to 70% made of fat. So these can contribute to neurologic conditions too if we can't get these toxins out of our bodies. So phosphatidylcholine holds the healthy fats in the membranes, and we can have new phosphatidylcholine recycling the cell membrane and getting the toxins out, rebuilding all the time all of our cells. Bile is also made of steroid hormones like estrogen. So our liver and our bile system, gallbladder, it's responsible for clearing a lot of excess hormones from the body. Antibodies, IgA antibodies, which protect our gut lining from infections, are also in the bile. The liver makes those. Other hormones and enzymes you see listed below. Glutathione is the main antioxidant produced in the liver, lungs, and brain. And it's actually something we give as a therapy in some cases. It can be taken in an oral form or an IV form. Many amino acids. So there's a lot of sulfur-containing amino acids in this bile to help clean the body. Glycine is the smallest amino acid, and that really helps purify the body, along with vitamins that are fat-soluble, like vitamin D, which is really, we're getting a lot of good information about vitamin D in the literature. We knew about it for calcium absorption and bone health, but it's got big ramifications for immune system health, anti-cancer benefits, and the list goes on and on. Vitamin B12, a little bit of that in the bile. Vitamin B2, and folate. So quite a lot is going on in this fluid. We never even really see it, except for a little bit of clue. And if we look at our stool, the color of our stool changing, that's something you can see every day. You can take a look at your stool. If you don't, I encourage you to do so, and your children too, and make them look at their stool before they flush, because you can get some really quick clues about what's going on with your detoxification system and the health of the overall body. Okay, so other facts about bile. Let's see, do you all have your handout now? Make sure you have it. Okay. All right, so bile helps us digest and absorb our fats, our protein, calcium, vitamins A, D, E, and K, which are fat soluble. This is so without absorption of fats, you really can't have healthy brain function because the brain's made of 60 to 70% fat. To grow a baby during pregnancy, the need for fat and protein and calcium increases exponentially the second and third trimester. Usually the first 3 months, mom can do a little bit of catch-up, but the second, especially the last trimester, it's very hard to catch up because the requirements are so high. Oftentimes, if mom can't get enough nutrition in during those last months, we see more premature deliveries, so babies born earlier than they should be. There's studies about this looking at fish oil, for example, even in women who are smoking during pregnancy. If you just give them a little bit of fish oil during pregnancy, they'll carry those babies to term. So there's huge implications for our children, for grandchildren, and everybody we know. And if we can't absorb our fats and our protein, guess what we eat to live off of? Sugar. We crave sugar and carbohydrates because we can't digest and absorb the fats and the protein. And that's what our bodies really need to build and repair themselves. So it's not your fault necessarily. You might not be able to digest and absorb properly. And that's some of what we look at with our patients. Okay, let's see, coming down. Bile production peaks at midday. So you're most likely to do your greatest digestion and absorption around lunchtime. So you want to eat a good breakfast and digest and absorb that by lunch, and then a decent lunch, and then probably a lighter meal in the evening, if you can, if you're having trouble with the bile system especially. Melatonin. I didn't know this until recently. Dr. Ron and I were talking a little bit about melatonin a few weeks ago. But melatonin is involved in the bile system. And actually, we make more melatonin in the bile system in the literature than in the brain. Melatonin, you might have heard, helps us sleep in our sleep cycles. It also has some anti-cancer benefits. But it helps convert cholesterol into bile, and it also acts as an antioxidant for the gallbladder to help protect it. And it also thins out the bile itself so it doesn't get sludgy and form stones. So melatonin production peaks between 10 p.m. and midnight, so you really should be sleeping between 10 p.m. and midnight. Those of us who worked the night shift for years, I mean, really, it's important in the history taking because of the detoxification and the stress placed on the body. So whenever possible, it's helpful to be sleeping between 10 p.m. and midnight. Unless you're completely on an opposite cycle and you've been that way for years, sometimes the body can adjust to that too. Okay, other facts about the bile. Glycine, taurine, phosphatidylcholine. So glycine and taurine are really important amino acids to make your own bile in the liver. Taurine is actually an essential amino acid for cats. It's how they have their night vision. It's not essential for us, but for cats, they have to have taurine, and that's why they like to eat meat, to get the taurine to be able to see in the dark. For us, we need it for many places, but two, we need it to make our bile, so we absorb our fats and our protein and do other cleaning for our body. And then we also use it as a neurotransmitter to help us sleep. So we see many cases where taurine's too low and we can't sleep. Sometimes in conditions like Crohn's disease or ulcerative colitis or even severe irritable bowel syndrome, the patients will have sandy stools. And when you have sandy stools, it means you have a taurine deficiency. So again, look at your poop. It doesn't sound glamorous, but it's cheap and plentiful, and it can tell you lots about what's going on in your body. Okay, bile is a means of detoxification we talked about. It can contain heavy metals to help detox the body. Pharmaceutical drugs, the liver clears a good 70-75% of most pharmaceutical drugs, if not more. If you take any environmental toxins, these are plastics, phthalates, petroleum products, and the list goes on and on. Toxins from our GI tract. This is something we often forget about. We think about, oh, there's pesticides on our food supply, or there's pollution in the air, or in the products we're using, but we don't even think about the 40 feet or so of small intestine we have. On average, people have about 25 pounds of undigested food in that small intestine. And if you can't digest and absorb your fats and your protein, and your carbohydrates to some extent, but if you can't digest and absorb your food fully and it sits there, it starts to rot, right? And then the bacteria, as a natural process, try to break it down. And you can form some really nasty chemicals, putrescine, cadaverine, other really nasty amino acids, amine byproducts that can cause a lot of damage to the intestinal walls and then enter the bloodstream and increase the toxicity burden. So we often forget about that small intestine piece, that it's quite long and can harbor even more toxins than we're getting externally. Okay, so keep your bowels moving. It's very important. Okay, the bile system also removes toxins that are too large to filter through the kidney. So the kidney is kind of like a sieve in what it can fit through toxin-wise, and the bowels really have to pick up the slack there. So keep the liver and the bowels and the bile system happy, and you'll live a good life. Okay, the bile protects the body from infections by secreting antibodies like IgA to help the lining stay intact and fight off bacteria and viruses. The bile in the gallbladder is 5 to 20 times more concentrated than the bile in the liver, and it's very expensive for our body to make bile. We make it out of these components: phosphatidylcholine, taurine, our B vitamins, some minerals, cholesterol. We have all of that in the bile, and it's expensive to make. So it's actually recycled. So the bile salts are used to help us absorb the fats, especially. They're secreted into the small intestine when we eat, and then the fats get absorbed, and the bile salts get reabsorbed in the ileum, kind of the end portion of the small intestine, and they go right back to the liver. So if there are toxins in this bile, they actually end up getting recirculated through the body. So fungal toxins like mycotoxins, some mold diseases, we see that, where the toxins keep circulating and the patients say, "Doc, I've been through everything and I'm still sick. What's going on? My mold counts are still high. I've remediated my house. It's not my house. I've eliminated all my sources." They're still recirculating in the body, and that cycle needs to be cleaned. Okay, so the liver. I want you to think of the liver as a city, if you're kind of new to the liver. It has highways and transportation, like blood vessels, arteries, and veins. It has factories. It makes so many proteins for us. So many wonderful things are made in the liver to keep us healthy. It also has a waste disposal system. And that's very important. And that's really the bile system, is the waste disposal. So we're talking about really thinking your trash man and keeping him happy, because if all the garbage builds up in the cell in this room, the cell starts to suffocate, really, and it can't function, and it starts to die. So it's got waste disposal, it's got security, we've got some in the liver built in. The macrophage cells of the immune system are very important there. It weighs about 3 pounds overall, located on your right side. It often spans to the left side, crossing the middle of the body. It's a pretty large organ in most people. Doctors can feel if it's enlarged, usually on exam, if we lay you down and we feel any liver edge past the end of the rib cage. It can be fatty liver, for example, or cysts in the liver, or something else going on. Typically, we push on the liver and the bile system on physical exam, and you might have pain there. It can indicate some irritation of the bile system and the gallbladder area, and some toxin buildup. So the liver acts as a filtering and cleansing device for the blood. It makes quite a few proteins, detoxifies hormones, alcohol, prescription medications. You name it. Filters 1.5 quarts of bile every day. So 3 pints of blood a minute. That's quite a bit of circulation through the liver. It's doing a lot for us all the time. It does have a rest period throughout the day. The kidneys generally don't have a rest period, but while we're sleeping, the liver generally gets a little bit of rest versus when we're up. So it really matters for removing toxins from the body. The liver is critically important. And again, probably one of the backbones of detoxification is a healthy liver. The Environmental Working Group put out a study a few years back showing that in newborns, they took the blood of newborns and looked at the number of chemicals that were in their bloodstream. They found on average 287 toxins in a newborn at the time of birth. So we know we're starting with quite a heavy burden now. We need, as doctors, better ways to quantify the toxicity levels. That's something we're actively looking for, because we really have no idea the upper limits. But we're suspicious, because what we're doing with this medicine is putting back the good nutrients in that are missing and then removing the toxins out. And we see people getting better in cases where they've been to specialist after specialist after specialist and haven't found a result yet. So it's pretty simple medicine, but we really need to quantify the toxicity burden for people. Okay. So liver, a healthy liver moves all excessive fat from the body to the digestive tract by the bile duct system and the bile system gallbladder. If the bile ducts are blocked, then you start to see the liver accumulating fat. And that can be one sign of toxicity. Like if the liver's enlarged or in an ultrasound, or if you've ever had a scan and they said, oh, there's some fatty liver. That's a sign that there's toxicity building up in the liver and the body, and that needs to be cleaned out. So big picture. The liver actually can form stones. We always think about the gallbladder having stones, but the stones can actually form in the little ducts of the liver, which are, you can see these little green ducts. You can start to form small stones basically when the toxins start backing up and the bowels are not moving well. And so the stones can form in the liver and then collect in the gallbladder. The stones can also form in the gallbladder because that's where the bile is concentrated 5 to 20 times higher. So the toxins are higher in that gallbladder versus the individual ducts of the liver. But you can get, even if you have your gallbladder removed, you can still accumulate stones in the liver. When that happens, the flow of blood backs up because these bile ducts are connected to the cells are connected to the bloodstream. So basically, the toxins are backing up in the bile duct system, the waste disposal system. They back up in the liver cells, they back up in the bloodstream, then they back up in the lymphatic system. And when that happens, you start to see the lymphatic system accumulating fluid. So the idea is if the body can't take out the trash, it knows it's going to die if it can't take out the trash. So what does it do? It takes on water to try and neutralize the toxins. And you start to see it typical what we know as belly fat, right around the midsection, around the belly button. The reason it happens there, we think about cortisol, but why there with cortisol? There's a group of lymphatics, it's very large there, called the cisterna chyli. And it's this big lymphatic accumulation right by your belly button. That's the first place you notice, because the lymphatic system is blocking up there. And really it goes back to the liver and the bile system. So the belly fat toxicity. Does that make sense to everybody? I want it to make sense. So basically, the trash has nowhere to go, so it's backing up all the way to the bloodstream and the lymphatic system, and the first big group is right by your belly button. So we see tummy fat first. Okay. So really, obesity, there's more lymphatic accumulation of fluid than fat cells in studies. So it's the body's way of trying to neutralize toxins that it can't get out efficiently. And it's smart. It's doing this for a purpose. If it let that toxicity just be in the bloodstream and not take on fluid to neutralize it, you'd see heart attacks, you'd see cancers, you'd see serious diseases. So the water weight is actually protecting someone from a serious toxicity crisis. So we don't want to just treat the symptoms, you know, oh, I'm gaining weight, or oh, I have this leg cramp. Don't just treat the symptoms. I really want you to think about what's causing those symptoms and correcting that, the underlying cause. Your body is always trying to heal you. It's always trying to heal. It will try to heal you to the moment of death. It will try to heal. It's always trying to compensate for us, and it's a beautiful, beautiful organism. Okay. So as the body accumulates more fluid, it becomes more congested with toxins. The cells start to really suffocate, and the circulation decreases. So leg pains, feet pain, gravity-dependent toxicity, you start to see more accumulate in lower. Some people usually have foot pain first. Joint pain can be seen. But some of these symptoms I put in a table for you. They're pretty common, but they can all be linked back to the liver and detoxification. So the mystery of the gallbladder is really it's telling you about the liver and your overall health and toxicity burden. Low appetite can happen if we have decreased bile. That also decreases our saliva production. It makes us more susceptible to infections in the mouth. Food cravings, if we can't digest and absorb our proteins and fats, we're craving carbohydrates and sugar because that's the only fuel we have to live off of. Does that make sense? We really need the protein and fat, but if we can't break it down and absorb it, our body says, fine, I've got to live off of something, until something changes. So really we want to reverse that and go back to the protein and healthy fats. Diarrhea. So if you don't have enough bile to absorb your fats and it hits your small intestine, whatever you ate that was fatty, then the bacteria start to work on it. They can ferment and make really nasty smelling gas, a lot of bloating, and you can have loose stools because the fat in the stool will cause it to float and turn loose. So fatty or greasy stool that floats on the water instead of sinks can mean you have some undigested fat in your intestinal tract and you're not absorbing all your fats like you should. So again, look at your stool. Sounds simple, but it's very important. Constipation, if we have a lot of toxins, sometimes we'll see constipation or magnesium deficiency can do it. Nausea and vomiting. If there are so many toxins in the body that they're backing up into the bloodstream and the body's done all it can to neutralize them by taking on water, if we have too many toxins in the bloodstream, often the body will try to get it out another route, right? It's trying to preserve life. So it will induce nausea and vomiting to get it out through the oral route. So if you're nauseous and detox, we never like to see nausea on a detox program. It means you're releasing toxins into circulation. You can't bind them and get them out fast enough. We slow down a detox. We look at other ways to get things out. But that can be a clue of toxicity and liver toxicity. Depression, this is interesting. You need fats for the brain, right? And you have to absorb them with the bile. So 60 to 70% fat, you've got to get those fats. If you can't absorb them, the brain is suffering. Also, with all the neurotransmitters in the gut, if you can't absorb your proteins properly, you break your proteins down into your amino acids, and you use those as neurotransmitters like serotonin and dopamine. So direct links to depression if you can't absorb your protein and your fat with the bile system. All right, I'll mention a few more here. Heart disease. This is really interesting. Have you ever seen Forks Over Knives or the work of Caldwell Esselstyn? He's a doctor who tried to reverse heart disease by basically taking out all oil and fat out of the diet. And it worked. It worked. He was reversing cardiovascular disease left and right. He did studies and several books were published about it. And I met him and listened to him present, and it was very interesting. That was the one thing that the patients couldn't do. They couldn't have a drop of oil. They couldn't have a drop of fat. But we know the body needs fat, right? And the brain needs fat. So over time, what are the ramifications of that? Can you leave somebody on a no-fat diet the rest of their life to try and keep their arteries clean? Something's got to be missing there, right? So what I found was that the diet works for cardiovascular disease. It's worked for many people. But the problem goes back to the liver and the bile system. The cardiovascular disease patients, if you look in their history about even 10, 20 years beforehand, they start having trouble digesting their fats and their proteins. When you can't digest your fats and you eat fat, it goes in your bloodstream. Some of it will get in your bloodstream in other parts of the body, and it binds with calcium. And it forms a soap-like substance. It's called a saponification reaction in medicine. So the fat binds with calcium and it deposits in the arteries and areas of inflammation in the arteries. So you can get to the same result with digestive enzymes and bile support that he did in the study by eliminating all fat. Instead of eliminating the food group, we need to try and help the body digest and absorb it properly. Does that make sense? So it's got big implications for heart disease. Okay, let's see. Hormonal imbalances, that's another one very closely tied to the bile system in the liver. The liver has to get rid of the majority of the estrogen for the body. When the liver's having trouble doing this, sometimes in pregnancy you'll see this, so when estrogen levels are really high, in liver disease for different reasons, sometimes you'll see the palms, and the doctors look for this on physical exam, the palms get red. And it happens when the estrogen backs up in the system. It will cause red palms. Right around the edge, not so much in the center, but around the edge. It's called palmar erythema. Everybody look at your hand. But it's a clue that your liver's having trouble getting rid of all your hormones, that it really needs to be cleaned out and opened up, the bowels and the liver and the bile system. It also, the estrogens can be xenoestrogens or foreign estrogens too. So we know from the Endocrine Society's paper, they have like a 100-page paper talking about environmental toxins mimicking estrogen in the body, especially the plastics. So for our children, we're seeing their little girls start their periods at 8, when normally, 50, 100 years ago, they were starting at 15, 16. Half the age. Breast development in our kids, way too young. Why is this happening? A lot of the chemicals they're exposed to mimic estrogen in the body. The liver's having a hard time clearing already. They're born with close to 300 toxins, at least one study cited for us. And so the liver's impaired, can't get all of these out, and so the hormones stay in circulation and the toxins stay in circulation and start activating hormonal receptors. So we need to clean up our bodies, and it can be done. It can be done. That's the great news. Okay, so that's hormonal problems. Mention a couple others. Frozen shoulder is interesting. So we talked about the tummy fat with the toxicity starting first in that big lymphatic collection, the cisterna chyli, it's called. So the fluid will back up there first. So 80% of your lymphatic system that helps clean the body is located from about here to here in the intestines. When that's backed up, then the shoulders and the chest back up. You start accumulating fluid there. When that's backed up, you start accumulating in the head. So a lot of times we'll see frozen shoulder if the intestinal tract is blocked and the lymphatic system is blocked here, and then the chest is blocked. It can be drained. There's manual lymphatic therapy, but you've got to address the gut. You've got to address the gut, the bowel movements, the bile system, and the liver to really open it up and leave it open permanently. So frozen shoulder, it's interesting. And you can have sports injuries and arthritis locally, but oftentimes we'll see a lymphatic system involved. Multiple chemical sensitivities. So multiple chemical sensitivities and asthma all kind of put together. Asthma can have many causes. We've seen even just magnesium deficiency be associated with asthma clinically, anecdotally, but bless you, I'm sorry. Multiple chemical sensitivities. People who react to perfume when they walk in the room, I'm one of them. People who react to laundry detergents, cigarette smoke very violently, new smells, new chemicals, even certain foods, if they eat them, automatically they'll have an allergic type reaction. Hives, swelling, angina in some cases. I've seen many patients who are kind of at that level who barricade themselves in their houses because they're too afraid to go out because they react to everything. What's going on is that the toxin load is so high, they're recirculating in the bile, and so you've got to get to that somehow. You've got to open the bowels, clean out the bile system, put the good foods in and the nutrients they're missing. There are several papers in the gastroenterology literature. The GI doctors, they're starting to realize this. Several papers showing in multiple chemical sensitivity syndromes, if they give bile salts, which should be in the bile, what we're making new bile salts to make new bile, the chemical sensitivities go down, the rate of hives go down, angioedema and swelling go down. So really, accessing the process, cleaning it out, and putting back what's missing can help decrease. Okay, let's see, I'll mention just one more. Maybe the kidney diseases are interesting. So kidney diseases, there's several papers coming out now showing that as the bowels get constipated, we see more kidney disease. And this doesn't make sense in modern medicine, but from the lens of detoxification, it does. If the liver is blocked and the bowels are blocked and you can't get toxins out through the intestinal route, through the stool, the next organ in line to take over is the kidney. Yeah, so the kidney has to do more work, and that can be harmful for the kidney over time. So we tend to see chronic kidney disease, at least I do in the history. I always ask about constipation, lifelong constipation, or what your bowel movements look like. Are they 8 to 12 inches? Are they 2 or 3 inches? How many do you have a day? Do they sink or float? All that matters, and since childhood, what were they like? All right. So next, gallstones. Down here. So has anyone ever had gallstones or seen gallstones? A couple people. I've seen some for myself too, yeah. They can be different colors, different shapes, hard or soft. They can be made of cholesterol. Cholesterol can actually crystallize if it's been around a while. They can be calcified, which is easier to see on ultrasound if they are calcified. They can have pigments like bilirubin, which is that breakdown product from the red blood cells as they just go through their life cycle. The bilirubin gives them their color for the most part. The more bilirubin, the darker generally they are. The less bilirubin, usually they're made more of cholesterol and they look more yellow. But they can be black, they can be green, they can be yellow. They can vary in size and shape from a pebble to a golf ball. I know somebody who passed a golf ball size stone once and was pretty septic, which means he had a lot of infection in the bloodstream. He did survive it, but he passed. I mean, I saw golf ball size stones, 2 of them. So it's pretty incredible. Usually you don't start having symptoms from stones until about 8 years after you've had them. So they've been around a while by the time you actually have symptoms. So that tells you the liver toxicity has been building up for, 8 to 10 years on average? Probably longer, but at least that. So it matters for people's health, I think, especially for chronic conditions. So 75% of all gallstones are cholesterol-based, where we don't have enough bile acids and other constituents of bile, like phosphatidylcholine, to bind that cholesterol and move it around. They can contain toxins, bacteria, occasionally dead parasites. Parasites aren't that uncommon in our first world country, believe it or not. Checking for them is uncommon now, but they're not that uncommon. We can get them from our food supply. One of the ways that I'm seeing them come in quite a bit now, even in the vegan population, which surprised me. I was trying to figure out, why am I finding parasites in my vegans? They don't even eat meat. Why am I seeing a meat parasite in my vegan patient? So it turns out the organic farmers, some of the organic farmers in our country are adopting the farming practices from China. And so they take the manure, which is nutrient dense, from the pigs, and they put it on the soil and the crops. But normally, if you look at farming practices over hundreds of years, the farmers always knew to just putting it on, and so there's parasite load even on our organic vegetables if they're managed by some of these farming practices. So even washing your vegetables when you get home, if they're organic, letting them sit with a little vinegar or hydrogen peroxide for about 10 minutes can help reduce that load. But we can have some parasites in the bile system, in the liver. Some of the larger worms are more common in third world countries, but we've seen them in the United States. I've seen them in patients. They're pretty sick when they have them. Okay, so gallstones, gall means bile, so the stones can form anywhere there's bile. They can form in the liver, and they can form in the gallbladder. Most of the time by doctors, they're missed in the liver. We don't look for them routinely in the liver. Probably one of the best ways to look for them in the liver is MRI, magnetic resonance imaging, but who has that all the time of the liver, and it's expensive. So realize that most people do have stones in the liver, and there are papers in the literature about it too, but I think it's grossly underestimated for the level of diseases we're seeing in the population that are linked back to the liver and the level of symptoms. Okay. Women are more likely to have gallstones than men. It's interesting. Well, women have higher estrogen levels, a lot more to clear through the liver. If you think about it, women have babies, right? Women have babies, and what do babies need during pregnancy? Protein, calcium, fats. So there's a higher demand on mom's liver and bile system during pregnancy than non-pregnancy times. And if they have multiple pregnancies back to back, then we lose some nutrients each pregnancy. So if the pregnancies can be spaced out a little bit, it lets mom rebuild the system a little bit more and hold on to more nutrition and be ready for the next one. So sometimes in history, if somebody's sick, we'll see pregnancies in a row, and we're thinking about nutrient depletion and overtaxing that bile system. Okay, so how to help the liver? How to help the liver, the bile system. So I'll give you some. We went over symptoms. Let me see where. So the foods are very important for this. That's one of the biggest places everybody can start. So you reduce pesticides, toxic exposures, chemicals, pharmaceuticals whenever possible, and then address the undigested food in the small intestine, especially meats. If you eat meats and they're not digested well, that's a higher source of rotting in the small intestine and some nasty toxins that are made. The foods are very healing to liver. Kind of all around us are these great plants that we can take in. Garlic has a lot of sulfur and can help the liver make glutathione, which is the main antioxidant. Grapefruit is very cleansing for the liver. It actually helps clean the liver out. It's one of the reasons why many doctors will tell you don't have grapefruit juice with the medication you're on, because it'll help clear the medication out of your liver and your bile system. Usually it takes 2 quarts to do that in studies, not 1 small glass, but grapefruit is a good liver cleanser overall. Green tea also can help, bitter gourd, a lot of the greens. Dandelion's one of the best, and we consider it a weed in this country and try to spray it everywhere. But organic dandelion without pesticide, one of the best to clean the liver. Spinach isn't too bad. Spinach, I usually tell patients not to cook because it increases the oxalate levels. If you've ever had kidney stones, that can matter for you. Walnuts, some of the fats and omega-3s in walnuts are very helpful. Avocados are a great powerhouse. It's kind of like a giant olive if you think about it, if you look at it. Has a pit. It is high in glutathione, another really friendly antioxidant for the liver. It's got great fats and vitamin E, lots of nutrients. It has 18 amino acids in it, quite nearly a complete protein, not quite there, but really close. Turmeric is an anti-inflammatory. There are others. Beets are great for the liver. If you like beets, beets 2 or 3 times a week in the diet, just a serving can really help clean the liver out. Kombucha, if you like kombucha, kombucha has something in it called glucuronic acid, and that's one of the detoxification pathways in the liver, is glucuronic acid. So it actually helps the liver get rid of toxins. Lecithin or phosphatidylcholine, which is in egg yolks and sunflower seed butter and sunflower seed oil, and sunflower seeds themselves, if you like them on your salads and things. Lemon. So the citrus oils are very helpful. If you like essential oils, come to Dr. Ann's talk. The citrus oils are great for the bile system and liver. It's one of the reasons they say lemon in your water. It needs to be lemon with the peel for the oil. The acid's helpful, but the oil is actually most beneficial. Even rubbing it topically over the liver area can be helpful in some cases if you're not sensitive to the oil. So the food's great, but I say that the bowel movements, and the food can help the bowel movements if you're getting some more roughage in your diet and more greens. Okay, and then digestive support. Enzymes, if you need some digestive help, digestive enzymes can be helpful to break down your proteins and your fats and get them absorbed easier, even with leaky gut. Ox bile, so you can take bile acids. Ox bile is probably one of the most common. that we see out there, but you can take that when eating fats especially, and it can help absorb your fats into your body. Let's see. Amino acids, phosphatidylcholine, we talked about some of those others. So we want to correct the nutrient deficiencies, and then we want to take the toxins out of the body. And really, you don't want to start pushing heavier detoxification until the nutrients are nice and high, because the liver needs those nutrients to get these toxins out and to make the bile, like your magnesium and some of your phosphatidylcholine, glutathione. So you really want to start opening up the bowels, getting the bowels moving, and then eating the whole foods is a simple way. And then supplements can help too if you're low in areas. If you've had your gallbladder out, people usually in studies need higher levels of phosphatidylcholine. Some respond well when given bile salts back. If they're having problems like diarrhea post-cholecystectomy after they've had the gallbladder removed, a lot of times giving them bile salts back will stop it. So that's a little bit about gallbladder bile system. I know it's a big topic, but feel free to ask questions. We've got about 15 minutes, and let you guys start. Yeah.
Is this hereditary, or is it all environmental?
Is the toxicity hereditary, or? Some studies show hereditary lines, but we consider a higher environmental cause, I think, than hereditary. I mean, I've had patients where their parents have gallbladder disease and bile disease, and we can get their bodies functioning better, and they have no problems with that system. Mm-hmm.
You talked about bile salts. Is that something that they eat every diet, or is that a supplement they can help with?
Yeah. So the question was, bile salts, is that something you can get from your diet, or is that a supplement you have to take? You normally make them in the liver, so normally your liver makes them. And you should be making total bile a quart to a quart and a half a day. Most people make less than that, unfortunately. But you need to be eating the whole food so your liver can make them. If you're having trouble with digestion and absorption, sometimes we will add bile salts back in as a supplement. Or if the gallbladder's missing, it can be very important. If a lot of digestion absorption is poor and diarrhea is going on or loose stools, we add that back and we see the stools improve and the absorption of fats improve. So normally we make it in the liver. Everyone can make it in the liver, but it can be taken in supplemental form if needed. Yeah.
Would you say if the gallbladder's been taken out, there's more of a tendency to get stones in the liver?
Mm-hmm. So the question was, if the gallbladder's taken out, is there more of a tendency to have stones in the liver? Typically, yes, because there's nowhere for that to accumulate. So oftentimes, cleaning that liver becomes even more important because you don't have a repository where it's concentrated and gathering the stones. You tend to have smaller stones in the ducts.
And so what else could a person do to support yourself if you don't have a gallbladder? Like, I don't have a gallbladder. You mentioned taking bile salts. Is there anything else, or just be very careful with keeping your system?
Yeah. Probably, so eating the whole foods diet, checking the nutrient levels to see where people are low is very key, especially the fat-soluble vitamins. They're at risk for being low in the fat-soluble vitamins, vitamin D, A, E, and K, and the fatty acids. Typically bile salts, phosphatidylcholine, B vitamins, and digestive enzymes in many cases can be helpful. We look at each case by case, but at least in the literature, those are some things that have improved patient symptoms and cases. Yeah.
I use spinach and kale in most of my smoothies, probably daily. And I have read that it's better to saute so that there's not too much oxalic acid. Is that wrong?
Generally, the question was, I use spinach and kale in my smoothies daily. I've read that if I saute the spinach and kale, it's a little better to remove some of the oxalic acid. From what I've read, if you overcook that spinach, it's at higher risk of higher oxalate levels in the tissue. So I don't know about lightly sauteing versus steamed spinach or completely cooked spinach, but I know it's a little safer for oxalate levels if it's raw versus cooked. Question? Yeah, so it's interesting. If the colon and the small intestine have a lot of toxins in them, the system backs up, right? So the bile can back up and actually reflux into the stomach, and change the pH of the stomach, lower the stomach acid production, decrease the absorption of proteins in the stomach, can lead to more ulcers in the stomach. And then we all have heard of the bacteria H. pylori associated with stomach ulcers. Anytime, well, I should tell you, infections even have a purpose. Nothing's without purpose. Infections even have a purpose. If you look in the forest, for example, you see there's tons of bacteria. There's a lot of mushrooms going on the forest floor. If it's a healthy forest, you'll see mushrooms. The fungus is there in the forest and ecology to detoxify the forest. So that's why a lot of mushrooms are poisonous. It concentrates the toxins. Same thing in the body. If there's a weaker area, lower in nutrition, and it's accumulating tissue that's dying, you'll see infections gravitate to that area to clean it up if the body can't get rid of the toxicity through the bowels and through the normal way. So anytime you see infections in the body, know that infections, bacteria, for example, don't infect areas that are healthy. It's a purpose of breaking down the tissue that's not doing well, and you need the nutrition in to stay healthy and keep the toxins away and keep the bacteria away. So it can reflux, yes, up to the stomach, we know, and lead to some more ulceration there. Sometimes the first part of the small intestine, if we get reflux there, you can have ulcers in the first part called the duodenum. You can also reflux up to the pancreas. Some stones get stuck in the pancreas, and that's a big deal. It can cause pancreatitis because all those digestive enzymes can't get out and start digesting your pancreas, and you get really sick and need to go to the hospital. So it can reflux to the pancreas. Some believe that's why there's more pancreatic cancer in the head of the pancreas. The pancreas has this head, and it's got a narrow tail. The head is where it connects to the bile system and the intestines. So they think that if the bile is constantly full of toxins and refluxing to the head of the pancreas, that might be why we see more tumors in the head of the pancreas than the tail. Yeah, question. Oh, sorry.
How is all of this like a fatty liver because you hear so much increase in fatty liver disease?
Yeah, it's a good question. So the question is, how does all of this relate to fatty liver? We hear a lot more about fatty liver disease increasing. So if the body can't get rid of the toxins through the bowels and they're backing up in the bile system, they back up into the liver. If the ducts of the liver are blocked with toxins, then the cells start accumulating the toxins and storing it as fat. So you see the liver cells actually accumulate fat, and that's what we see as fatty liver. So when I look at that, if I see that on an ultrasound or a scan, I know there's some liver toxicity that needs to be dealt with in the patient. But I think because we're seeing more toxins in our environment and toxins in our intestinal tract we're not dealing with, moving our bowels regularly, we're seeing more fatty liver. B vitamins are very important for the liver to function, magnesium, all of these nutrients the liver has to function to clear these toxins out. So when there's nutrient deficiencies, we're more likely to see the toxins accumulate in the fatty liver.
Okay.
Does that make sense? Yeah.
I heard that milk thistle was supposed to be good for the liver.
Mm-hmm.
Can you comment on that?
A question or a statement is milk thistle. I've heard that it's supposed to be good for the liver. Can you comment on that? My naturopaths in the room are probably even better well-versed to comment on that than I am. I'm just beginning to scratch the surface with herbs. But to my understanding, milk thistle has some good capabilities to purify the liver and get these toxins out. There have been some cases with milk thistle where the liver enzymes will elevate, indicating some cell death, and the standard doctors get pretty nervous with that. But we think what's going on there, and some studies show that it's actually removing toxins so fast from the liver that there's cell damage if the ducts aren't open and the intestines aren't open to take the trash all the way out of the body. In general, I think milk thistle has been used for a long time to help the liver, but we need to make sure the GI tract is open, the bowels are moving well, and some ground rules are established first before using herbs, because herbs are powerful. They are very powerful. Does that answer? Okay. Question?
I have, for 20 years or more, I've been complaining to doctors about a pain in my, that would speak to gallbladder problems. But nobody ever said anything about the gallbladder until recently. They did a scan and they said, it's an ultrasound, and they said, it's okay. But I started many years ago taking lecithin granules for cholesterol.
Sure.
And every time I would take it regularly, the pain would go away.
Yeah.
And then I would forget to take it, the pain would come
Sure.
because I'm terrible at taking supplements, that now it's suddenly dawning.
Gallbladder, yeah, and bile system and liver, yeah. Yeah, so the comment was, I've had pain around the abdomen for several years. Doctors really haven't known what that was. Had a scan recently, an ultrasound, and saw no stones or anything, but noticed when I take lecithin over years for a while for cholesterol problems, the pain would go away. And when I stopped, the pain would come back. When I'd start lecithin again, the pain would go away. So a lot of times gallstones aren't caught on imaging. They can't even be pretty soft and not seen on bless you. So they might not be able to even pick it up, but symptoms like that usually to natural medicine doctors are a clue that the bile system could be involved, just because that's kind of how we approach the patient, as we look at the patient as a whole and we think about the deficiencies, the toxicity, how the organs are functioning to get rid of things on a daily basis. But yes, lecithin's very helpful. Very, very helpful.
So would you say that that's helpful to anybody that
I mean,
it's an emulsifier.
Mm-hmm. Yeah, it's very helpful. I think it should be in our diet normally. I think it really should be there. Egg yolks, sunflower seed oil, sunflower seed butter. If we're having bile trouble, I often will give it as a supplement as well. I can't blanket recommend things because sometimes there's cases where it's not safe for certain people, but I haven't seen that in practice. So I kind of look at everybody as an individual, but I will agree with you. I found it helpful in the patients I've treated. Yeah. Question? No, cleaning out the bowels. And we didn't get into it in this lecture because I'm just introducing this concept to you and kind of trying to pull things together for you to start thinking about. There are gallbladder and liver flushes. I think those are very helpful. They need to be under the care of a physician of some kind. There's a proper way to do them and an improper way to do them, and you can get into trouble very fast if you don't do it properly. Also, I like to know if there's stones, giant stones that people have, because if you have a stone the size of a golf ball and you try to flush it out of duct the size of a pencil and it gets stuck, you can have an infection, you can drop your blood pressure and get into trouble real fast. So I don't think it's safe for just the majority to do that. Some people do, many people do flushes and feel great. The intestines need to be open first. There's lots of things to think about with that. I think it's a powerful tool, but it needs to be applied to each individual case, and the timing needs to be right. Yeah, question. Great question. Yeah, great question. So lecithin actually helps dissolve stones. Lecithin, which is that phosphatidylcholine, that can help dissolve stones. Digestive enzymes can help dissolve stones. And there's a plant from South America, Shonka piedra, stone breaker, that it can help dissolve kidney stones and gallstones. And it depends what the stones are made of too, but generally all three are helpful. I think you were first.
So are the digestive enzymes also a supplement, or are those diet? Can we get them through our diet?
So the question is, are digestive enzymes a supplement, or can we get them through our diet? So enzymes are in all the plants that we eat normally. The plants help digest themselves. We have some digestive enzymes in the plants all the time. That's one of the problems we see with more processed and prepared foods. When we don't eat a lot of raw foods, is over time we're depriving ourselves of the enzymes and taxing our GI system and our liver and our bile system, all of that. So the enzymes can be in the plants. That's one source. Our pancreas makes the enzymes normally. There's different types. Lipase is an enzyme that helps us digest and absorb our fats. Proteases help us digest and absorb our proteins. They're made in our pancreas normally. The pancreas can get overworked, though, if it's constantly eating too much meat, constantly eating too much sugar, constantly eating too much unhealthy fat. It doesn't have any more juice to give. It needs some rest time. So that's one reason. They can be taken as a supplement. Some are vegetarian source. They tend to be a little weaker. There are some from cows, from pigs, from lamb, pancreatic enzymes that people can take to help digest and absorb their food. Interestingly, the strongest look to be porcine or pork-based. If you think about it, a pig can eat slop, right? You can feed a pig anything and it'll break it down. Why is that? It has very strong enzymes from its pancreas that it makes. So you can take them as a supplement. you know, doctors need to be involved in those decisions typically, I think, because there are cases where you can take too many on an empty stomach, and if you don't take them with food, it can create a problem and create an ulcer too. They're that powerful. Just like if a stone gets stuck in the duct going to the pancreas making all those enzymes sit there, have nowhere to get to the gut, and so they start digesting and breaking down the pancreas because it's made of protein too and made of fat too. So you kind of need to use them properly, but they can be taken as a supplement too. Yes. Question. Say that again? Citric acid. I don't know. Maybe Dr. Ron or Dustin, Dr. Moffitt. I don't. Yeah. I don't know how to answer your question, honestly. When you take it as a supplement? Oh, okay. Yeah, it could be if it's in supplemental. I don't have a whole lot of experience with it. I mean, in canning, I've used vitamin C before. I'm trying to think citric acid. I don't think I've used. I'm not sure. I have to look it up to answer your question. Question? The question is, for cleaning the colon, coffee enema, how often do you need to use it? Once a day, twice a day? Coffee enemas have been around for a while. I think in before the 80s, they were actually in the Merck manual and recommended as therapy. The nurses used to give them, I believe, in World War II for pain reduction. And I don't know exactly how they started. I think they started on the battle lines, but they've been used in various protocols you'll come across for cancer or for removing toxins from the body. There's mixed literature about it. Some people feel very strongly for them. Some people feel very strongly against them. Dr. Gerson was a German doctor. He used them frequently in cancer, along with a lot of juicing of organic vegetables and some fruit to clean out the colon. He actually, in stage 4 cases, reading his memoirs, he used them every couple hours in stage 4 patients in the hospital who were in a coma and would bring them out of a coma. So I think it depends on the level of toxicity. There's some risks to that too with coffee enemas. If the immune system's too low, like with chemotherapy, don't really want to stick anything in the rectum, because you can break the lining and get bacteria into the bloodstream, and even your good bacteria could infect you. So if the immune system's too low, you don't really even want like a rectal exam. And that's something we do in the hospital. We even avoid that. But some people do use coffee enemas. From what I've read, they need to be organic, specially prepared coffee for those enemas, a very light roast. Typically, it's not recommended that the coffee is strained through any kind of coffee filter because some of the beneficial acids are removed. They contain caffeine, so if you're sensitive to caffeine, that's something to think about. But as far as how many a day, that really depends on the level of toxicity and how the patient's responding if they're using that therapy on their own. I've had patients who are using them on their own coming to me who say that, I have a patient, he's had 3 different cancers, and he uses them. He decided to start that on his own, and he says he really can feel a difference when he uses them, when he does it daily. I was talking with Dr. Nick Gonzalez. He's a doctor in New York. He died a year and a half ago. He treated a lot of patients with cancer using Dr. Kelly's approach of high-dose pancreatic enzymes, coffee enemas, and lots of nutrition and juicing, and getting rid of mercury and all kinds of things in the body. He would do 2 a day himself, living in New York, to keep up with the toxin load, I can tell you. I think it depends how the patient feels, how they respond, and the safety levels for them. But many patients use them daily. Many patients use them weekly. Many patients use them once in a while. Some patients I've had also, they're on their own getting colonics or cleaning the bowels out that way to remove excess waste. But if you can work from above, that's probably the easiest and less invasive. What you're putting in to help the tract move. And if you're low in certain nutrients like magnesium, definitely increase that and get the tract moving. But yeah, there's lots of different ways. Does that answer your question? Okay. Yeah. Anybody else? We're about 5 minutes over. Yeah.
Is it more important to take enzymes with cooked food then versus like if you're eating raw food in your meal?
Cooked meat or cooked veggies, you mean?
Both, I guess.
It can, especially the vegetables. Yeah, if you're cooking them, I think it's helpful if you're having trouble digesting, absorbing. Most people, the meat especially, the meat if you're having a lot of meat in your diet and you're not digesting and absorbing that properly, it's just going to sit in the small intestine if it's not fully absorbed and create worse things. So it depends on the case, but it's helpful from what I've seen. Yeah.
What are some healthy fibers to help with
Yeah, there's so many fibers. Yeah.
chia seeds?
Chia seeds are a great fiber. They come with a caveat. I always tell patients, hydrate them. They have to be hydrated so they get that jelly-like feeling around them. Let them sit for a while, or overnight's even better. Because if you take them raw, like on a salad, or you just have a spoonful, it will suck the water out of you to hydrate them. And that's the last thing you want, is to get dry and have fiber. So soak them first, I always say, but they're a great source, and they have omega-3 fatty acids. Trying to think, haven't had any, maybe diverticulitis, be careful. But if you soak them first, it should glide out a little easier. So chia is a great source. There's so many fibers out there. There's fiber products. I mean, greens in your diet is great for most people. But yeah, chia's fine.
All right, I think Dr. Nia maybe can stick around if there are any more questions afterwards. But thank you so much. That was wonderful. And I just ask that if you guys don't mind filling out the survey, that's helpful for us. Especially write down if there are any lectures, any topics you really want to hear about. Please write that down because we're planning the fall lecture series. We've got one coming up in June. Dr. Hinshaw will be talking about sleep and sleep disorders. I think that's June 14th. It's a Wednesday. And then also at your place, everybody has a coupon for 20% off in the store today. So that's good for just today, but you can get 20% off your entire order. So, so look for that in your packet of stuff. So, but otherwise, thank you so much.
Thank you. Yeah. And I'll be around for a while if anybody has other questions.